Coronavirus crisis in the national capital. Delhi recorded 7,486 new COVID cases on Wednesday, taking the infection tally in the city to over 5 lakh. While 133 new fatalities, the highest single-day count in data till date, pushed the number of deaths to 7,943. Now, the new cases came out over 62,000 tests conducted the previous day, marking a positivity rate of 12.03% amid the festive season and rising pollution in the national capital, according to the latest bulletin issued by the Delhi Health Department. The highest single-day spike in cases so far has been 8,593. Which was recorded on the 11th of November. Now, Chief Minister Arvind Kejriwal has called for an all-party meeting today to discuss a strategy for COVID management and containment in Delhi, where cases have been spiraling since October end. The meeting is likely to be attended by the BJP, Congress and Aam Aadmi Party legislators and will be held at 11 a.m. in the Delhi Secretariat. Meanwhile, in terms of emergency measures in view of the rising COVID cases, the Delhi government has allowed COVID-designated hospitals to engage 4th and 5th year MBBS students, interns and BDS doctors to assist duty doctors in controlling the pandemic. According to an official order, the 4th year and 5th year MBBS students and dental doctors will assist duty doctors at an honorarium of 1,000 rupees for an 8-hour shift and 2,000 for a 12-hour shift per day. Well, let's go across to Arun for more. And Arun, the coronavirus crisis is exploding. Health Minister Satyendra Jain had earlier suggested that the third wave, that the peak was past us and cases would now be going down. Instead, we're seeing cases once again on the rise. And what's more worrying is the number of deaths taking place.
Of course, these figures are painting a worrying picture, Gargi. If we look at the number of deaths, it peaked yesterday with 131 fatalities, which has been the highest till now. So that is definitely worrying. Other than this, of course, another issue that Delhi was battling was shortage of ICU beds, and that is why Delhi government has asked 11 hospitals, and they've spoken to the medical directors of these 11 hospitals to convert their normal oxygen beds to ICU beds. Now, this will take the number of ICU beds to 1830 in Delhi. So that is one very crucial step that was much needed, and considering the situation and considering the figures that we are seeing, it was much needed as well. Again, as you mentioned, there would be an all-party meeting which is going to happen at 11 a.m. that Delhi CM Arvind Kejriwal has asked. Another thing which Delhi government has done is asking these hospitals to engage 4th and 5th year of MBBS and BDS students to engage in delivering their health services as well. So these are some steps which were needed, and there would be some crucial steps coming out of the meeting that is going to happen today, Gargi.
All right, Arun, it will be interesting to see, even though Satyendra Jain, the health minister, had ruled out any kind of lockdown in Delhi, it will be interesting to see what sort of measures they announce after this all-party meeting. Thanks so much for that.